All right, I'm going to demonstrate a low dye taping technique that's used for trial period for just to see if my patient may need permanent orthotics. If the person has excessive pronation and they're actually having patellofemoral pain, this taping technique is used to reduce that pain. And so there are specific clinical predictor rules that could determine whether or not this taping technique may be beneficial. And this would be if the patient has 2 degrees or more of great toe valgus, 70 degrees or less of great toe extension, and 3 millimeters or less of navicular drop. So I have my patient lying prone, and I'm actually on the posterior side of her. And what I'm going to do is create I'm going to have her relax her foot here so I can actually create a little bit of an arch for her. So this is going to be, so she's going to stay relaxed. I'm going to start actually at the great toe metatarsal head and wrap around this direction and do that for each of the feet or each of the toes. So I'm going to take a nice long piece of athletic tape and start at that great toe or that metatarsal head. It's a nice long piece. I'm going to create a little bit of an arch and wrap this around the calcaneus, avoiding the Achilles, so that when they bend their foot, or she bends her foot, it doesn't, it's a bit long. She doesn't, her ankle doesn't become irritated. And then anchor that down. And I'm going to do that for each of the toes. Let's go to that medial, that second toe. Each of these pieces of tape would be about the same size. So again, at that second metatarsal head. And again, wrapping around, creating an arch. So what I'm actually doing by keeping her foot in relaxed position is creating an arch. Sorry if you did that. Making that nice and smooth. And anchoring it on this 5th metatarsal side. Purposely reverse this a little bit. Right. And then I would continue that with each of the metatarsals. And then so that this doesn't fall apart, I'd want to anchor it with a piece of tape going lateral to medial. Coming around both sides. Right from here, coming around the top side to anchor that around. Good. And then one more to hold all of that in place. And holding that in place. So this is the low dye taping technique to help support or create an arch. And if this is actually if this is successful and my patient does have decreased pain, then my patient this actually can be used documentation-wise to prove that my patient would be able to be fitted for an orthotic.